My name is Allison Snyder, and my presentation today is on demonstration with return demonstration. First off, we'll start with a few definitions. So according to Bastable 2014, demonstration is done by the educator to show the learner how to perform a particular skill. Here I've posted a picture of an educator showing a learner how to start an IV site. Return demonstration is carried out by the learner in an attempt to establish competence by performing a task with cues from the educator as needed. So before we get started and break down the major components, I've posted a video of a learner demonstrating a task back to an educator regarding starting an IV site.
Hello, my name is Lena and I'm going to be your nurse today. Can you verify your name and date of birth for me? Thank you. Alright, well, I'm just going to be giving you a new saline lock IV. So that way we can give you some fluids and your medications. Apply a little pressure to find a good vein. Alright, perfect. I'm just going to set up my supplies real quick. Okay, I'm just going to clean your site. Apply a little pressure again. Okay, here's going to feel a little pinch. Ready? Okay, very good. And I'm just going to take this needle straight to the sharp spots. Okay, make sure it's a good vein. Perfect. Alright, there you go. I'll come back on to check on you in a little bit. Okay.
Now to break it down, we will get into the major components of this teaching method. So first of all, the educator should inform the learner of expectations prior to beginning the teaching. This includes explaining the purpose, why is the skill important, what will it be used for, how will it benefit the patients, explaining the steps. The learner needs to be aware of what steps they will take and in what order they need to use the steps to perform the skill. What equipment the learner will need. They need to be educated on the equipment and become familiar with it prior to starting. And the expected action should be explained. They should make the learner aware of what is expected of them and go through the whole demonstration with them prior to them doing the demonstration on their own. This type of learning is best with small groups. This can either be 1-to-1 or in small groups of like 2 to 3, but large groups is discouraged upon when utilizing the demonstration with return demonstration teaching method. It's also most effective when lecture is given prior to demonstration. Taking a minute to slow things down really helps to enhance learning. So another component of this teaching method is scaffolding. So this is when larger things are broken into smaller steps in order to help create a more clear, precise image. So rather than going straight to demonstration, it can be more beneficial to break down the steps prior to demonstrating the task. For instance, with a Foley catheter insertion, it may be beneficial to first review the human anatomy, go over what equipment is necessary, and then demonstrate the task and have the learner demonstrate the task back to you. Practice is extremely important with this type of teaching method. So in order to be an effective educator, the difficulty level of the skill and the level of the learner must be assessed. Mistakes also happen, but you need to take advantage of them. If a mistake occurs during demonstration, take it as a learning opportunity in order to demonstrate how to overcome the mistake with the learner. This can help build rapport between the learner and the educator. Practice should also be supervised until the learner can perform the task accurately on their own. Practicing helps to make learning more concrete, and once the learner has obtained the skill, they can perform the task by themselves and work on developing speed and proficiency then. And return demonstration should also occur closely after demonstration in order to help promote learning. The educator acts as a coach. So during this time, while the learner is using return demonstration, the educator should remain silent and only offer cues when necessary. So only coach, do not do the task for the learner. Let the learner perform the demonstration and only intervene if you need to. Interruptions should also be avoided. You don't want to create small talk or ask questions, as this can just lead to distraction and can interfere with the learner's train of thought while they're performing a task or skill. Demonstration with return demonstration relates to the psychomotor domain because you're performing a skill or task and it's being hands-on. So during this time, allow plenty of hands-on time with the equipment and try to use the exact equipment when available that the learner will be using. If the learner is taught with a different kind of equipment than they will be utilizing on their own, they could become anxious and frustrated very quickly. It is best to use the equipment that the learner will be working with so that they become familiar with that equipment when you're not around. For example, if a patient is using a standard walker in the hospital but will be utilizing a rolling walker at home, it would be best to have the rolling walker brought in order to help get them used to using the rolling walker. Cognitive and affective domains are also part of demonstration with return demonstration. Affective domain means that the learner must determine the worth of the skill that is being learned. So how important is the skill to the learner? And then cognitive relates to knowing the principles, relationships, and processes in carrying out the overt physical movement. So the learner needs to be able to think through the task and apply knowledge in order to perform the given task. There are many advantages to the demonstration with return demonstration teaching method. First off, it enhances learning through the psychomotor domain and utilizes 3 senses: visual, auditory, and tactile. The learner is able to utilize hands-on learning and is able to see and hear information in order to help solidify this information in a way that makes it easier to remember. Repetition and reinforcement help make learning more concrete. It also makes the learner feel more confident and competent in their skills and their ability to be able to retain the skills that are being taught. And lastly, the goal is achieved through overlearning. So practice essentially makes perfect. By doing the skill over and over again, teaching is more likely to be effective and stick when the learner goes to do the skill on their own. However, there are also a few disadvantages to this teaching method as well. It can be time-consuming, as time must be set aside to focus on learning and for practice. And this type of teaching should also be done in small groups and should have a one-to-one evaluation. So that also adds to time-consuming and staff utilization, as smaller groups are being utilized and needing more time. The other disadvantage is that this method can be costly. Equipment can be expensive, and with lots of practice comes the use of lots of equipment. However, in order to help deal with this, reusing equipment can help cut down on costs. So here's a few examples of how this teaching method could be used in a healthcare setting. So example number 1 would be discharge teaching. We can help to bridge any communication gap that may occur between the nurse and the patient. We can confirm that the patient understands the information, give them plenty of time to ask questions, and have the opportunity to teach back concepts and/or skills to the educator. And we can verify that the patient understands, correct information that may be inaccurate, that they may have misunderstood, and we can help reinforce new skills. Example number 2 would be precepting. This allows for one-to-one teaching and learning. Most new nurses are on orientation for about 12 weeks, and we try to have a consistent preceptor so that we can go over skills and take the time to educate them so that they're able to perform the tasks on their own. It allows plenty of time for the learner to practice these new skills, and they can ask plenty of questions. And we can verify their understanding of knowledge and skills as well. And the third example would be our annual competencies. So these are used to assess skills and to enhance continuing education. So the validator is available to help make sure the skill is being performed correctly and is able to help correct mistakes. And it allows for opportunity to ask questions and improve on knowledge and skills again as well. So this concludes my presentation, and here's a list of my references. Thank you.